Good morning, everyone out there. Dr. Mark DiPasquale here from Adjusted Chiropractic. Welcome to some more healthy news. Today, I'm going through some more details with regards to the importance of vitamin D and the immune response, especially with regards to COVID, flus, colds, etc. Some amazing research that we've just gone through once again. Now, it's a research article that was published in the first wave of what we were actually going through. In countries around the world. I'll just go to the article now. And it was published in the American Journal of Clinical Pathology. This is the article here, if you can see it on my screen here. The abstract goes through objectives. It's got the full article. You can actually go to it. I'll put the link in the description. So you can go through it if you do want to read the entire article, the results, the discussions, etc. But quite amazing. Not amazing. We knew this. We know this about the importance of vitamin D, and that's why I've been speaking about the immune program, or the immune response, how it works, the immune system, and how to support it to keep it strong, and also when we are going through a cytokine storm. So I will just summarize that again. I just want to go through the main points just very quickly on this article here. Just to allude at what it's actually talking about. So before I get to the protocols, I just want to go through a couple of key points that this article showed. And in summary, vitamin D deficiency on admission to hospital was associated with a 3.7-fold increase in the odds of dying from COVID-19, according to an observational study, looking back over the data over the first wave. So what that means is 3.5% fold increase in the odds of dying once administered to hospital with COVID. So the first thing that strikes my mind is, obviously now we've seen many people in our community who have had COVID, gotten over COVID as well, and are well after that. But if one gets bad enough respiratory-wise and they have to go to hospital for urgent medical care, a 3.7 times increase in the chances of dying with being deficient of vitamin D, or when one is deficient of vitamin D. I mean, that is striking. So what it tells me is get the vitamin D into us, specifically, very urgent. So in the study, it was found that nearly 60% of patients with COVID-19 were vitamin D deficient when they went into hospital, with men in the advanced stages of COVID-19 pneumonia showing the greatest deficiency. So it's saying that 60% of people who had to go to hospital when they had COVID-19 for help were deficient of vitamin D. And guess what? Men were a greater amount deficient than women. This is not new information. We've known this information for some time now with regards to our general population and the deficiency of vitamin D. And these findings were highlighted by the authors of the research paper, that clinical trials need to specifically be targeted at vitamin D deficient patients at intake. So when they do enter hospital, are they vitamin D deficient? And that needs to be addressed. And to make a call for general avoidance of vitamin D deficiency as a safe and inexpensive possible mitigation measure against the COVID pandemic as well. One of the other things that can be done, there's many things that can actually be done to help and activate the immune system in the current times that we're in. A couple of quick quotes from in the paper. This study shows how severe this problem is. A 3.7-fold increase in death rate if someone's vitamin D level was below 20 micrograms per mil is staggering. It is arguably one of the most important risk factors to consider, end quote. Another quote, numerous observational studies have shown that low vitamin D levels are a major predicator for poor COVID outcomes. And this comes with the understanding, and another quote, that this is likely due to the loss in the protective action of vitamin D on the immune system, in the cytokine storm, end quote. So there is much more in that article, in that journal, to go over. I just wanted to summarize it because it can get quite intense, I suppose, with the more information. But I think the bottom line is, with vitamin D and vitamin C for the immune system is something that is so, so important. I'm going to go over in a minute. I'm just going to go over the immune system protocols now, but I'm going to go over in that research paper where vitamin D is actually deemed a hormone, not actually a vitamin. And that is very interesting to understand because if we understand that it's a hormone, we understand how crucial it actually is to the body functions, particularly in the immune system. So here's the immune system protocols. This is to keep the immune system boosted. So we really want to have these compounds, ingest these, take these on a regular basis when we're well, in the event that our immune system has to work. So vitamin D, vitamin C, oligomeric proanthocyanidins, which is called commonly known as pycnogenol, and it's also a polyphenol. And then if we do have a cytokine storm, what we want to do is we want to actually up those numbers by 5 times. So the vitamin D, 5 times the amount, vitamin C, 5 times the amount. We want to include zinc sulfate. That's what allows the nutrients to penetrate the cells, to stop the spike proteins and to affect the spike proteins within the cell. Oligomeric proanthocyanidins, 5 times once again. If we are at higher risk, this is why we're talking about vitamin D today, because this is it is so crucial with regards to understanding this information. Now, I just want to move back to the article and show you something which is pretty important. So here we are back in the discussion of the article and just drawing your attention to this area here. Vitamin D is a steroid hormone with many non-classical actions that mediate immunologic response to respiratory viruses. And then it goes on to state, and survival of critically ill patients. It is crucial that vitamin D is in our system. That pretty much, this is not bringing you this here to prove anything. In the literature, this is well known. It's a matter of people that are, people are speaking about this, supporting each other in these findings as well. Because one of the things that is happening is there's still a lot of fear out there. There's a lot of unknown, and we're 2 years down the track pretty much here now. There is a lot that is known now. Looking after the immune system, looking after ourselves the way we should always be doing is the first line of defense, that's for sure. So vitamin D is hugely crucial. We are here to help any way we can. So please contact us if you have any questions. You can contact any of our team as well. If you're watching this on YouTube, please subscribe to our channel so that you're any new videos that we put up, you can be notified and watch those as soon as possible. Please like it as well so that more people are exposed to this valuable information. Other than that, yeah, please contact if you have any questions. Continue helping your family and friends. Look after your health because in the end, no one else will. Bye for now.